The high temperatures we're seeing this summer can certainly be dangerous, and it's important to keep yourself safe in any way you can. In this afternoon's On Call, anchor Melanie Hebert has some tips.
Heat is the #1 weather-related killer, according to the National Oceanic and Atmospheric Administration. So with all of the heat advisories we've had lately, we want to tap into our on-call network to help keep you and your family safe. So joining us to tell us more is Dr. James Callaghan, a ER doctor at West Jefferson Medical Center. And Dr. Callaghan, with the heat index exceeding 105 degrees these days, what health dangers can people face if they're out in the heat too long?
Well, we often see the obvious, of course, which is sunburn. We see heat rashes, heat exhaustion, heat cramps. Sometimes this can progress, and in rare occasions we see a heat stroke. There are a lot of things that people can do to obviously stay out of the heat, but I guess if a lot of people can't avoid it, they end up with these problems.
Now, what about precautions? Are there some things that people should take if they're outside for long periods of time?
Yeah, of course, if you can't avoid the heat, wearing a hat, finding the shade, because obviously the temperature's 10 degrees more, less in the shade than it normally would be. So finding the shade, and if of course you can't find the shade, hats, light-colored clothing, hydrating yourself before you go out and while you're there. Making sure that you feel well hydrated somewhere along the way. Most people don't know when they're getting dehydrated. A good rule of thumb is if you haven't urinated in the last 4 hours or so, you probably are not drinking enough fluids.
And so what should you do if you feel overheated, or maybe you're starting to feel a little sick from the heat?
Obviously, the first thing would be to try and get out of the heat as best you can. And then try and rehydrate. We often tell people not just water, because water, although it gives back your fluids, does not give you back your electrolytes and your salts that you lose when you sweat. So we often tell people to try and drink sports drinks such as Gatorade and Powerade, and try and rehydrate yourself with something more than just water.
Some great tips for us. Dr. James Callaghan with West Jefferson Medical Center. Thank you so much for joining us on Call.
Thank you.
And you at home can watch more of our On Call segments online anytime on WDSU.com.